you've recently released a report at the JP Morgan conference. It's called Follow the Exits: Why Women's Health is a Smart Bet in Healthcare. What were some of the key findings in this report? Why is women's health a smart bet in healthcare?
So some of the key findings in this report, and the reason we put this report together is because there is this misconception and perception that women's health is a niche and really emerging category. There have been quite a few reports. The first one was led by McKinsey that really talked about the $1 trillion women's health opportunity, that this is a future opportunity. There's so much potential there. And what we heard from investors is that they were waiting for something that can actually anchor the space, anchor the market to say, this is a real category that we can invest in and there's potential for returns there. And as somebody who has worked in women's health for the last 15 years, has been part of 2 successful women's health exits, myself and my co-founder, Oriana, who's the CEO, were talking and we said, what do you mean you're waiting for the first one? There's this one and this one and this one. And we could name multiple large multi-billion-dollar exits just off the top of our head because we have been in this space. And so the reason we put together this report is to show people that this is a proven and scaled healthcare market. Yes, it is an enormous future opportunity and it is already performing and has performed. There are over 27 unicorns in this space, and that there's already $100 billion in realized exit dollars that have been returned to investors. And to actually show that this isn't new, this isn't altruistic, that this is truly a profitable and important and strategic category. So you asked me about some of the top findings from the report. One of the top findings is that we've already seen over $100 billion in exits, and an exit means a transaction, either a merger and acquisition or an IPO, of money that's returned back to investors that they've invested into these companies. And that also means that there's a significant appetite and demand from acquirers, your large diagnostic or medical device companies, or also pharma, who are then taking these products and really ensuring wide dissemination to all of, throughout healthcare to all women, so it reaches every single person and provider. We also saw that it's accelerating. Nearly half of all the exits happened in the last 5 years, and we're seeing the trend really speed up to show that those companies that have been started over the last 5 to 10 years are now delivering those results and returns, kind of talking about that opportunity, that future opportunity that's already happening now. And it's only the matter of time of how much faster we're going to reach the next 100 billion, right? As compared to the first 100 billion. And some of the biggest ones is that there's already been 27 unicorns in this space. And when I went out to speak to colleagues in the space, as we're making this report, I would just ask, how many unicorns have been in women's health? And they would say, none. We're waiting for that first one. Or somebody would sometimes give the benefit of the doubt and be like, probably one. And when I would say there's been 27, that was really eye-opening to them in terms of the size and scale of the market.